Hey everybody, it's Jessica DeMassa with What's the Future of Health? I am talking to the who's who of health tech and healthcare innovation. And today we are excited to have a brand new guest on. Please meet Erez Raphael. He is the CEO of Dario Health. So Erez, it's great to have you here with us.
Thanks, Jessica, for having me on your show.
So for those who may not be familiar with Dario Health, they caught my eye because of a double acquisition, like 2 acquisitions already this year in 2021. So you started out in January. You guys are publicly traded, we should say that, on the Nasdaq. Over there, the symbol is DRIO, chronic condition management company. And you guys acquired MSK startup at the top of the year called Upright for $31 million, along with a $70 million private placement into the company. And then like a few months later, here you are again. You guys have acquired a behavioral health company called wayForward for $30 million. So Erez, let me pick your brain about these 2 acquisitions. Talk a little bit about how these 2 companies, one bringing behavioral health and the other one bringing MSK care, how they're augmenting what you guys currently offer over there, focused on diabetes, pre-diabetes, and hypertension.
Yeah, absolutely. So for many years, we are building a digital therapeutic solution. We started with the metabolic side, started with diabetes, expanded into hypertension, weight loss, and you know that we are a publicly traded company. And for those that are listening for our earnings calls in the last 2 years, they know that the strategy is eventually to create one integrated platform. The promise that digital therapeutics companies are coming with is how we can provide a very good personalization. So the idea is creating hyper-personalized experience. And in order to be there, we need to deal with multi-conditions under one integrated platform. So we did a lot of work in the last 2 years. The 2 announcements came in like less than 4 months. But this is a result of a lot of, couple of years that we were building a platform that will be very generic and it will be easy to integrate our other solutions into the platform. And then we did these acquisitions. We knew these companies for a while, and we acquired them. Well, the overall objective is to integrate everything under one platform, one user journey, and hyper-personalized experience that is being done with one AI engine that is controlling everything. And this is where we think is the future of our company. And this is where we're going to spend a lot of time and focus getting one integrated experience.
So this is not a model that is new in this chronic condition care space. I mean, we saw Livongo acquire MyStrength for behavioral health, offer their own hypertension platform. There was talk of them doing an MSK acquisition before they themselves got acquired by Teladoc. And then you've got other players like Omada Health, who acquired Physera, an MSK company, to round out their diabetes, pre-diabetes, mental health offering. You've got Vida Health in this space. You've got OneDrop in this space that covers multiple chronic conditions, all built with the same idea of bringing all of the data into one AI engine. How do you stand apart in this space? I mean, it seems like it's getting so crowded.
Yeah, so let's start with the history. The idea,
okay.
The history is very important. I mean, Dario Health, as opposed to all the rest of the companies, started as a direct-to-consumer company. And it means that the way that we designed our product and the way that we launched the product to the market was consumer first. So while a lot of companies are talking about user-centric and consumer-centric and the consumerization of health and so on, we did it in practice where we launched the product into the users. We got tens of thousands of users that used to pay out of pocket for our solutions. And eventually we created an experience that is one of the best in the market, because the overall objective of all of us, all the digital health and digital therapeutics companies, is to create the best engagement. The only way to get the best engagement is to put your solution into the hands of the users and just get the real feedback. So if you're going to go to the App Store today, search for Dario Health, you're going to see that we have almost 17,000 reviews with 4.9 stars. Net Promoter Score 77. This is something that can be created only by a user-centric company that started direct to consumer. This is fact number 1. Fact number 2 is that eventually we have seen other companies that are making some acquisitions in order to have multi-chronic conditions, But I think that the devil is in the details. In order to get the best experience and a good user experience, you need to integrate the solution in a way that users will feel that they are part of one integrated journey. They need to feel that when they are getting a message that related to their metabolic side, we are also aware to the mental side and so on. So I think that all of us, I mean, the companies that are making these acquisitions and building platform and so on, all of us have a lot of work to do in order to get to a level that we are creating one integrated experience. And in a lot of cases, I see companies that are making acquisitions and they are managing them in a way that it's like a holding company. We are not a holding company, we are a technology company, and eventually we're going to have one integrated user experience. So one of the things that we will have this year is the first version that everything is going to be integrated under the same platform. And I believe because of the very user-centric approach that we have and the way that we design the foundation of the platform on the metabolic side, I believe that we will know how to do the best disintegration. And I believe that our value proposition is going to be superior comparing to the competition.
Can you say a little bit more about this integration as far as, you know, I mean, you said this year, you think it's going to be, you're going to be able to outflank the competition with it. Why is that? I mean, can you give us a little bit of maybe spill us some gossip about what we can expect with your integration?
Yeah, so practically we know Upright for 2 years. We know wayForward for more than 6 months. So we started to work on all these kind of things, and this is something that is work in progress. We don't see one application for all the conditions. We do see one look and feel. We do see one experience in terms of the backend, the AI engine that eventually is managing the user journey in a way that users will feel that there is one integrated screening, one integrated journey where we're going to send the messages or communicate with the users in a thoughtful way. The content management is going to be very smart. And later on, we're going to see also smart things about how to identify other conditions from someone that is only that is like suffering from one condition, try to understand what's going on from a different perspective and try to provide additional support. So we are not trying to be too smart in terms of telling users what they need, because we don't want to be too aggressive on that end. But if we can create some kind of help, one integrated coaching capabilities, one integrated screening capabilities, one journey, that's something that we believe will provide a lot of value, not just to our users, but also to our clients that are buying the solutions on behalf of their employees and so on. So that's the plan.
Okay, I'd like to hear a little bit more about the last thing you just said too. So you had said earlier, you guys started out as a direct-to-consumer company, and now you guys are selling B2B. So talk a little bit about the shift there. I mean, I know in the States especially, it's like, and you guys are a global company. It merits being said that. I mean, you're based in Israel, you yourself. I mean, but it's like here in the States, I mean, a lot of the new and innovative solutions, they start by getting in and integrated in with an employer. Is that what attracted you to go B2B to C? Or was there something more? Tell us a little bit about the decision there.
Yeah, so we are building software for many years. I mean, the founders of this company and what we did in the last few years is relying on things that we did for many years. We believe that eventually the best product manager is the user. I mean, people can think on behalf of the user what you're going to like or whatever. The only way to see whether something resonates among users, to look into how people are responding, so data is the most important part. From our perspective, digital therapeutics, it's about real data that prove real clinical outcomes. And eventually, the only way to generate data is to put the solution as fast as possible into the hands of the users and operate. So from our perspective, the standard product development life cycle of a digital therapeutics company is first of all to get the data. Without the data, we cannot go to health plans, we cannot convince them that they want to adopt a solution. And the asset that we built in the many years that we are doing direct to consumer, this is something that serves us very well when we are going into the health plans market, into the employers market. So we started this transformation by the beginning of 2020, and we have a very strong team in the US that is running this transformation. By the way that this whole company is being created is that we have a very strong R&D team in Israel, and we have a very strong commercial regulation client success team in the US. So that's the way that we are kind of operating. US is our major market. And after 18 months into this transformation into this B2B market, we started to see some traction. We're winning RFIs over the competition. And now we are starting to get the sales in a much more scalable way, which is what we expect from the B2B transformation.
And you guys have some pretty impressive numbers in terms of the number of people that you have on your platform. I think it was 75,000 on the metabolic side, 90,000 using the MSK solution via Upright, and then 20,000 using that wayForward behavioral health platform. So when we start to put all of that together, you guys have achieved quite a bit of scale so far.
Yes, we know how to manage users on scale. The experience that we are bringing from the B2C on the metabolic and the MSK side is very important and superior. And this is why we are very confident in our ability to win also into the B2B, because eventually if we are looking into the clients, self-insured employers and health plans, they're looking for really engaging solutions. They look to get a very good pricing model. They are very well defining who is active users, who they are willing to pay for. You know that this is something that is becoming more and more challenging for this company, for a lot of companies. And we bring tons of experience from the direct-to-consumer market that gives us a lot of confidence that we're going to be super successful also into the B2B market. We already started to implement few accounts. We're getting amazing numbers in terms of user enrollment, user engagement. So we are, we are very positive about what we are heading for.
All right, so we've seen in the last year and a half or so much money be poured into health tech companies and specifically into this chronic condition management space. And if you want to narrow down a little more, especially on the behavioral health side, right? So I'm curious, when you look at the competitive field around you, a lot of these companies have a ton of money. And I understand you guys you were publicly listed on the Nasdaq in 2016. Your market cap's 350 million. It's just which is awesome, but it's there are some competitors out there who, still private, like Hinge Health. They raised 300 million in their last round. It's insane. Or Vida Health, 110 million a couple months ago. Or you have others like One Drop that has raised 100 million, supported by Bayer in the background. Omada, they've raised a total of, I think, right around 250. So it's how do you, what do you see moving forward as far as, who wins in this space? Does the amount of funding you think really impact who's going to be able to make an impact? Or is the addressable market in the US just so big for this that there's room for all of you? What do you think?
Yeah, so my opinion is that there are a lot of digital health companies and tons of solutions. Most of them are focusing on one condition. So I think that the market is going to go number one into consolidation. A lot of small companies. If you want to sell into the B2B market, you need to have a lot of capital. Not every small company will have the capital in order to penetrate into the B2B market. There are tons of companies that are knocking on the door of employers. The market, these clients are overwhelmed with solutions. So number one, I think that we're going to see consolidation into multi-conditions. Number two, I think capital is very important part. In the last 8 months, we raised 100 million. In the last 5 years, we raised 200 million together. So I think that we are fine in terms of raising money. We can always do more, but we are fine in terms of being able to deliver on the plans. But I think that you're right. Capital is a very important part of being able to win. And I think that now, if we are counting all of the companies together, Livongo, Omada, all of us together, we are penetrating into the market in terms of chronic condition management, digital therapeutics, only 2-3% of the market. So it's huge market, but those that will have enough capital, very good foundation in terms of products, are going to win. And another thing, I think that the market is slowly moving from per member per month. It was we've seen companies that were billing clients for active users that are active every 6 months or 3 months and so on. Now it's per member per month. And 2 years from now, 3 years from now, it's going to be pay-per-performance.
Yep.
So those that will have the best solution, the best engaging solution, and will be able to show clinical outcomes, these are the big winners. And I think that all these companies will have to prove that they are really providing value to the clients. And these are going to be the big winners. So it's a combination of the right technology, the capital, the combination of multi-conditions, and this is where I'm driving our company to be, and this is why I'm positive about our future.
All right, so last question for you then. So I want to hear a little bit, speaking of the future, like gaze into your crystal ball for me and issue some predictions, because I mean, you've got your finger on what's going on in this space, you know, from a health technology standpoint, as well as, you know, just an understanding of the market sentiment in terms of both patients and, you know, other buyers like employers. So, I mean, we all lived through this pandemic. You know, we all saw, you know, the role of virtual care change and evolve. It seems a lot more sticky than it ever has been in the past. At the same time, a lot of concern about the health of people. You know, their mental health is in a worse state than it was before this pandemic. A lot of people experienced weight gain as a result of being home and not having, you know, certain activities to participate in. So how do you feel like this is going to shape the chronic condition care market moving forward in like both the near and the longer term?
Yeah, so when we are looking into the number of people that are suffering from chronic conditions, it's something that is overwhelming all over the world, but also the United States and so on. So I don't think that there is some other choice but to manage this kind of huge problem with digital solutions. So the COVID is something that pushed forward solutions like Dario and others, but the problem of chronic condition was before COVID and it will stay after COVID. So the way that I'm looking at it is that eventually digital solutions are going to take over. Clients like employers and plans will not be willing to pay for medical devices as a standalone that they don't know whether people are using it or not. In the future, they will not be willing to pay also for pay-per-use. They will look into pay-per-performance only. So it's going to be a huge kind of a race into getting the best engagement and the best clinical outcomes. And I think that companies like Dario and others are going to grow in a way that eventually they will take over solutions that are very silo. If you think about it, like 10 years ago, 20 years ago, we have seen a lot of companies that were like, we are a company that, companies that are specializing in diabetes management. So they have the best medical device in diabetes management. And a lot of companies are focusing on only diabetes management where people are suffering from other conditions. So the ability to look into the user and think from a more harmonized experience, integrated experience, that's something that is going to be crucial in order to help people improve outcomes. So consolidation, the ability to provide personalization, and then also show real clinical outcomes. That's the future of the market, regardless with COVID or without COVID. That's the reality.
All right. Well, let's leave it there. You'll have to come back as soon as you acquire something else because you're on a little bit of an acquisition spree. So we're excited to see what you guys at Dario Health do next. Thank you so much, Erez Raphael, the CEO of Dario Health. We appreciate you stopping by to talk to us about your business and about all the exciting things that you have coming ahead.
Thank you so much, Jessica, for hosting me.
No, it's a pleasure to speak to you. I love this chronic condition management space. So it's like, I feel like, even though there are so many other, companies that are doing different things, you're all doing them just a little bit differently. And I love the subtleties of the approach. So thank you so much for sharing. It's been a pleasure.
Thanks a lot.
Thank you. I'm Jessica DeMassa. If you want to catch more interviews with those who are changing the way that we do healthcare for the better in the future, please check out my YouTube channel over there at youtube.com/WTF Health. We'll talk to you guys soon. Again, Dario, thank you so much, the CEO of Dario Health, Erez Raphael. Thank you.
Thanks, Jessica.